And now we are coming to our presenters. So we've got Dr. Norman Giesbrecht, a co-investigator, Dr. Tim Naimi, a co-investigator, Ashley Wettlaufer, who is our method specialist and research coordinator, and Dr. Kara Thompson, who is also a co-investigator on the project. You've likely seen all of these folks present at previous CAPE events. If you'd like to learn more about them, their bios are on the CAPE website. And now I'm going to turn it over to Norman.
Thank you. The first slide. Thank you. This presentation will provide an overview and rationale for CAPE. It will also describe the project methodology and alcohol policy domains, and it will present results and recommendations for both the federal and provincial territorial governments. Next slide. What is CAPE? CAPE provides rigorous assessments of how well each level of government in Canada is implementing policies proven to reduce harm from alcohol use. The first assessment was performed in 2013 for provinces only. The second assessment included all provinces and territories in the federal level. And the third assessment again included all provinces and territories and the federal level, and is supported by the establishment of a nationwide community of practice. Next slide. I don't see the slide for some reason.
I think Amanda's just changing the decks, Norman.
Okay, great. I'll just wait for that. No problem. Okay, what does CAPE offer? Accessible, evidence-based, up-to-date information for policymakers, researchers, and NGOs. A systematic policy comparison between Canadian jurisdictions and over time. Platform for informing public health about effective alcohol policies, and a mechanism for keeping a public health approach to alcohol policy on government agendas. Next slide. Why does CAPE matter? In 2020, Canadians consumed the equivalent of 487 standard drinks of alcohol per person aged 15 and older. It led to over 17,000 deaths, over 103,000 years of productive life lost, and almost 118,000 hospital admissions. The economic cost of alcohol in Canada was estimated to be $19.7 billion, more than any other psychoactive substance, including tobacco. Net revenue from alcohol in Canada in 2021 totaled $13.5 billion. This is resulting in a deficit of $6.2 billion, so it is clear that the costs of alcohol exceed revenues. The next slide presents this alcohol deficit in more detail. Using data from Stats Canada and the Canadian Substance Use Costs and Harm Study, we see that every province and territory in Canada runs a deficit from alcohol. The last row on this table shows the loss per standard drink. In short, alcohol does not pay their way. Alcohol sales do not pay their way. Next slide, please. The World Health Organization recommended tightening alcohol regulations during the pandemic, with cost-effective and easy-to-implement policies to reduce the alcohol attributable burden of disease during a time when much of the population was stressed and anxious. However, we observed the opposite, relaxation. There are many policies in place to ease accessibility of alcohol. However, there were other factors in addition to COVID that contributed to the higher alcohol consumption. I'm going to turn it over to Ashley Wettlaufer. Thank you.
Thank you, Norman. So next, I get the pleasure of walking you through the CAPE methodology. And I'll start by saying that the CAPE process has continued to evolve since the first iteration of CAPE. So we've always been learning how to improve based on the valuable feedback that we've received from not only our validation teams that Amanda was mentioning earlier, but stakeholders across different governments and including the federal provincial and territorial governments. Next slide, please. So CAPE follows a rigorous methodological process, and I'll review the main steps with you outlined here on this slide. So first, we refined our scoring rubric. So the rubric is the template that we use that details the policy indicators for which we collect and score data. These indicators are considered the best practices in alcohol policy, and they're grouped into policy domains. The domains are based on broad areas with well-established evidence showing positive impacts for public health. And many of the CAPE policy domains overlap with policies identified in other well-established policy frameworks developed by the WHO, Pan American Health Organization, MAD Canada, etc. Next, we developed the domain weights and the indicator scores. So each domain is weighted based on 1, its effectiveness in preventing or reducing alcohol-related harms, and 2, its scope in terms of its population reach and the proportion of harm it can mitigate within the population. The project team weighted the domains by rating them on a 5-point scale across these 2 dimensions, and then the final weights were determined by project topic experts using a Delphi survey technique. Then the policy indicators that make up the domains were similarly weighted relative to one another within the domain using point value scales out of 10 points. And these indicators were compiled into 2 separate rubrics, one for the federal assessment and one for the provincial territorial assessment. And both rubrics were sent to a team of international peer reviewers, and they provided feedback which was incorporated into the rubric revisions. And once the rubric was developed, we were ready to collect policy data and then apply the scores. The data we collected was for 2022, or the most recent year available. And data was first collected online in publicly available documents. And then we reached out to key contacts within the federal and PT governments that were identified in different government departments. And they were asked to provide data not available or not readily available in the public domain. And subsequently, they performed data validation by reviewing the completeness and the accuracy of the data files. And as Amanda mentioned, we worked with over 55 data validation teams across the country in validating the data, well over 100 individuals. Then the data scoring was conducted independently by 2 CAPE members, and the scores out of 10 points were calculated for each policy domain by summing the indicator scores. And then the domain weights were applied, and the PT and federal overall policy scores were tallied. We also pulled the highest scores achieved by any province or territory for each of the indicators, and we tallied the overall score that could be achieved by a jurisdiction if they were to implement all of those best practices that are currently in place in Canada. And we refer to this as the best existing policy score, and you'll hear more about that as we move through the results section. Next slide, please. So now that we have a handle on the methods, I'd just like to highlight some of the changes that were brought about between the last iteration of CAPE and CAPE 3, the current project. The CAPE domains and policy indicators have been updated for CAPE 3 to reflect the latest research and evidence. So as the research has evolved, so too have the policies included in CAPE. And there are now over 300 policy indicators evaluated as part of CAPE 3. That's up from, I think, 250 in CAPE 2. Previously in CAPE 2, we had this concept of policy facilitation that was used in weighting the domains. And we now have incorporated this concept into our definition of policy effectiveness. So this change in definition just better reflects how the team members were weighting the domains to begin with. CAPE 3 also places more emphasis on assessing industry impacts, involvement, and even interference in policymaking and implementation. And these changes have resulted in new domain weights and rankings for the policies included in CAPE 3. So obviously these changes impact how we interpret the CAPE results between these iterations. Results are not directly comparable between reviews, but they do reflect the overall direction of governments and their approaches to alcohol policy and addressing alcohol harm in Canada. And finally, I'd be remiss if I didn't mention the launch of the CAPE Community of Practice that was new with CAPE 3 and now has 350 members from all 13 provinces and territories and federal representatives. Next slide, please. So before we move into the results, here's just a quick look at the policy domains included in CAPE 3. There are 10 domains included in the federal assessment and 11 domains included in the provincial territorial assessment. And the stars here indicate domains that will be presented in detail today. Details of the 300 plus CAPE indicators can be found in the scoring rubrics that are available online on the CAPE website. And it's important to remember that the policy domains assessed by CAPE form part of a comprehensive and synergistic approach to preventing and reducing different types of alcohol harm. So it should be noted when we present the various knowledge products from CAPE, the domains will be presented in rank order based on weighting of effectiveness and scope, or in other words, their highest overall impact in terms of promoting public health. So let's try to keep that in mind as we move through the different domain results. And now I'll turn it over to Tim Naimi, who will start us off with some findings.
Great, thanks, Ashley. Excuse me. Yeah, that was excellent. Well, we were great to hear about the methods, and now we're going to move on to the results. If there was a drum roll, it would be playing right now. So this first slide is just showing you all a visual preview of the 4-page results summaries that will be provided that are available now starting today. There's a results summary for the federal government. That's actually the face sheet of that is shown on the left there. And for each province and territory. So that has information on all these different policy domains. Those 4 examples of provincial and territorial ones are shown on the right. As Ashley mentioned, we're going to touch on just some of the key results today, and we have got a lot more details in our reports and knowledge products. And just as a reminder, CAPE provides an assessment at a point in time, and it really is focused more on the existence of policies rather than exactly how well they're being implemented or in some cases enforced. Next slide, please. In terms of the federal government, and that the overall CAPE score was a 37% with an F grade. And you can see here the scores for each federal policy domain are listed below. And I'm just going to touch on some of them. Pricing and taxation, the grade was a 39%. On the good side of the ledger, there is a 5% federal tax on alcohol. And the federal alcohol excise taxes, meaning those that are based on the volume of beverage, are indexed to inflation, which is good. However, recently a 2% annual cap was passed for indexing. And what that means is that in high inflation years, like last year and this year, taxes are eroding in relative terms by not keeping up with inflation. And then in turn, why this matters is that it makes alcohol progressively more affordable relative to other goods and services that promote health. Marketing and advertising got a 10%. Basically, the laws and regulations for following and controlling advertising are outdated. They rely heavily on industry self-regulation, and they do not cover many important forms of media, including all digital media. Impaired driving countermeasures got 40%. There is random breath testing legislation in place and a system for tracking and publicly reporting impaired driving statistics, but the criminal code threshold for driving under the influence is set at a BAC of 0.08 rather than 0.05. Physical availability for the federal government scored a 100%. I would mention, however, that the federal controls in this domain are mainly scored on commercial and personal alcohol imports, which meet our recommendations. But the physical availability area for policies is primarily governed and under the control of provinces and territories. And you'll be hearing more about that from Kara. The legal age got a 0%. That's because there is no federal minimum legal age for the sale of alcohol. It's currently set by the provinces and territories, and there it varies from 18 to 19, not the recommended age 21, which has been shown not only to reduce consumption among youth and young persons, but to lead to reductions in heavy drinking later in life for people who are exposed to earlier minimum legal age laws. Monitoring and reporting, there's a publicly funded comprehensive monitoring and reporting system that's done every 2 to 4 years, and CCSA provides great leadership in this area. So that got a very strong score. Next slide, please. So here's a selection of key recommendations for the federal government. And I should note that many of these recommendations have not changed substantially since CAPE 2.0. For pricing and taxation, we're recommending to increase the level of GST and having excise taxes tied to alcohol content rather than the volume of a particular beverage, because it's the ethanol that's that should be the subject of the taxation. For marketing and advertising, again, to be blunt, the CRTC code needs to be updated as it only applies to broadcast media, and at its heart, most of it relies on self-regulation, which is an oxymoron. Regulation shouldn't mean you get to do mostly whatever you want, and to be self-monitoring and self-policing. For health and safety messaging, we recommend implementation of federally mandated alcohol labels with standard drink information and health warnings. Mandatory standard drink and health warning labeling was called for recently by the new Canadian guidance on alcohol and health. But Minister Bennett has unfortunately voiced her support for continued self-regulation. But we should also remember that we have mandatory health labeling for tobacco and cannabis. Why not alcohol? Even in the United States, they've had mandatory health warning labels for more than 40 years. We need to develop an updated national alcohol strategy that's based on public health and developed without industry involvement. In terms of control systems, we need to implement a federal alcohol act, which we have, again, already for tobacco and cannabis. Why not for alcohol? And it's crucial to provide incentives for provincial and territorial governments to retain their alcohol monopolies, which better protect health and safety compared to a fully privatized system and help earn money for taxpayers to cover the deficit that's incurred when alcohol is sold in Canada currently. Next slide. That was a long slide. So in terms of provincial and territorial CAPE scores, the average CAPE score across all provinces was 37%, so matching the federal one, with the highest score of 44% in Manitoba. And the slide shows all the ones for the different provinces and territories. Next slide, please. Now let's look at the PT results by policy domain. This chart shows the average policy domain scores across the provinces and territories. The highest average scores across the provinces and territories were for screening and treatment intervention. That was a 67%, and monitoring and reporting at 63%. It's important to note that these are lower weighted policy domains in terms of their impact on alcohol and harms, but it's still good that they're doing well. The domains of pricing and taxation and physical availability are those with the greatest impact on alcohol harms and are the most heavily weighted domains in our scale, as Ashley mentioned. These two areas, these two domains scored 29% and 40% respectively. So there's lots of room for improvement in these important areas. The lowest average score across jurisdictions was for health and safety messaging domains at 13%. And again, a shout out to the importance of having mandatory labeling for standard drinks and health warnings. Next slide. Ashley mentioned this as well. The CAPE scores that we've just presented reflect the performance of each province and territory according to the best practice for alcohol policy as captured in the CAPE scoring rubric. And we admit that these are pretty tough standards. But we also analyzed the policy data to see what score could be achieved by any jurisdiction if they were to implement all the best policy practices that currently exist somewhere in Canada today. So this could be thought of as like a best practices, not as judged by the CAPE team, but in comparison to provincial and territorial peers. And as Ashley mentioned, we call this the quote, best existing policy score. And we like to think that the concept is more elegant than its long name. But the bottom line is that if a province or territory implemented all these current best practices, it would result in a best existing policy practice score of 80%, which is an A-. And really the important point here is that really good alcohol policies are achievable if PTs adopt even the best practices of their peers. Next slide. So now we're going to take a look at the results of 4 domains at the provincial and territorial level. And I'm going to talk about pricing and taxation, and then Kara Thompson is going to talk about physical availability, control systems, and marketing and advertising controls. Slide. Pricing and taxation was considered the most important and was the most heavily weighted policy domain in CAPE. It consists mainly of indicators around minimum pricing policies, taxation, retail markups by monopoly, and existing average prices. We see here that the average score for pricing and taxation across Canada was 29%, with PEI scoring the highest at 51% and Alberta and the territories scoring the lowest. Slide. Now this slide is busy, but I'm going to talk you through it. This shows the indicator scores or pricing sub-scores for pricing and taxation by province and territory. And I'm just going to mention a few examples. The minimum pricing sub-scores are indicated by the blue lines. And we looked at whether minimum prices apply to all beverages, whether they are indexed to inflation, and whether prices reflect ethanol content rather than just the volume of the beverage. PEI, Nova Scotia, and Newfoundland have the highest average off-premise, meaning liquor store or grocery store, minimum prices for alcohol sold in Canada, whereas Alberta, Yukon, and the Northwest Territories and Nunavut do not set any off-premise minimum prices. In terms of minimum pricing for on-premise establishment, like bars and restaurants, that's represented by the mustard yellow. It's the same criteria as for the off-premise services. 9 provinces have minimum pricing for on-premise establishments, but none set their on-premise minimum prices at the recommended level for all beverage types. Newfoundland and Ontario have the lowest on-premise minimum prices in the country. Alcohol taxes, that's represented by the gray bars. PEI, Quebec, Yukon, Saskatchewan, and BC all tax alcohol at a higher rate than other consumer goods and or apply separate additional taxes for alcohol through several mechanisms. So that's great. PEI is particularly noteworthy in applying a 25% health tax to alcohol and also having a relatively high off-premise minimum price. That means that most other provinces and territories, however, treat alcohol with no additional taxes and sell it then just like an ordinary consumer good, like a book or a swimsuit. In general pricing, that's represented by the orange bars. Across Canada, alcohol prices are not keeping pace with inflation, with the exception of beer in just some jurisdictions. This is leading to greater affordability of alcohol relative to other products and other goods sold. This is obviously not great for public health. Next slide. Oh, sorry. Oh, and then the best existing practices score. I wanted to mention that although the overall policy scores were low in this domain, if jurisdictions implemented all the best pricing and taxation policies, their average score would change from a 29, could go up to an 88% or an A. So again, there's lots of good stuff going on, and it can be achieved in the right circumstances. So some key recommendations for pricing and taxation are to tax alcohol at a higher rate than other consumer goods to reduce harms and cover the cost to society to attack that deficit, to base minimum prices on ethanol content, meaning $1 per liter of ethanol or per Canadian standard drink, since ethanol is the active ingredient causing harm, to raise minimum prices to the recommended levels, $2.04 for off-premise things, that's in 2023 dollars, or $4.07 for on-premise establishments, to index minimum prices to inflation so they automatically rise with inflation. And those are our main recommendations for that. And now I'm going to hand things over to Kara Thompson.
Great, thanks, Tim. I'm happy to share the results for some of the other domains. So as Tim mentioned, physical availability was also very highly weighted in the CAPE scores. And physical availability refers to the number and density of licensed establishments as well as their hours of business. And we can see here that the average score for physical availability across Canada was 40%, with Nunavut scoring the highest at 65%. So if we take a look at the indicators, so these are the different indicators that make up the total score. Okay, the first one is density, placement, and hours and days of sales of off-premise outlets. So these are the blue bars. Nunavut has the highest score and lowest per capita off-premise outlet density in Canada, with only 2 retail outlets. This is followed by Ontario, who is the second lowest per capita off-premise outlet density. However, most of the jurisdictions that we looked at have very high per capita off-premise outlet density, ranging somewhere between 5 and 11 times the recommended density of 2 outlets or fewer per 10,000 capita. There are only 2 jurisdictions, Saskatchewan and the Yukon, that currently have legislated density limits that take population into account. And in regards to where outlets can be placed, most jurisdictions have legislative power to implement placement restrictions, but the majority don't do so. And with the exception of Northwest Territories, the hours of operation for off-premise retail outlets extend beyond the recommendation of 11 a.m. to 8 p.m. with fewer than 7 days of sales per week. So if we turn our attention to the orange bars, we're talking about on-premise density, placement, and hours of sales. These are our bars and our restaurants. Nunavut, Ontario, and Saskatchewan score the highest for their policies restricting on-premise outlet density, as well as placement and hours of sale. Now, currently there are no limits set on density for on-premise outlets in any jurisdiction, even though many of the jurisdictions have the power to do so. And the recommendation for on-premise outlets is 15 outlets per 10,000 capita. Now, Nova Scotia and the territories are currently the only jurisdictions that have restrictions on where on-premise outlets can be placed. So for example, Nova Scotia restricts the placement of on-premise outlets near schools and hospitals, as well as other similar places of business. And again, the hours of operation for on-premise establishments extend beyond the recommendation of 11 a.m. to 1 a.m. in every jurisdiction. So the last set of indicators, which are the gray bars here, is takeout and home delivery. So takeout and home delivery, we've seen a lot of change in this as an indicator since as a result of COVID largely. We've seen a lot of loosening of restrictions related to takeout and home delivery. And takeout and home delivery increase the spatial and the temporal availability of alcohol, particularly for minors. So it can have a really big impact on physical availability of alcohol. You can see if you look at the gray bars that the Yukon scores 100% on this indicator because they prohibit all home delivery of alcohol from off and on-premise licensed establishments. Newfoundland follows closely at 79%, as does the Northwest Territories at 73%, because they both prohibit delivery from off-premise outlets only. However, in 10 of the 13 jurisdictions, they allow some kind of delivery of alcohol, takeout or home delivery, and many by a third party, so by companies like Uber Eats or DoorDash. And this makes it really challenging to ensure compliance with other types of alcohol policies like the minimum legal drinking age and not selling alcohol to minors. So if we take a look at the key recommendations for physical availability, provinces and territories can strengthen their physical availability score by setting population-based outlet density limits, as well as putting placement limits for their premises in terms of where they can be located. We also recommend the jurisdictions reduce and legislate their maximum trading hours to our recommended limits and to prohibit the delivery and takeout of alcohol. Now, if jurisdictions implemented all the current existing best practices across jurisdictions in Canada, the average score, which was 40%, could increase to an 82%, so an A-. So there are certainly some excellent physical availability policies currently in place, and lots of room for score improvement. So the next domain I'm going to speak to is control system. So control system refers to how alcohol is regulated and distributed within a jurisdiction. So this can range from the ideal of a government monopoly, where there's a system of government control over wholesale, retail sale, as well as distribution of alcohol, or to a completely privatized system for retail sales of alcohol. Now, evidence indicates that privatization and deregulation lead to greater outlet density, and that this ultimately promotes competition between retail outlets that results in lower prices, longer hours, and less rigorous interventions to prevent sales to minors. So what you can see here when you look at the total scores across the jurisdictions in control system is that, other than Nunavut, the alcohol control systems across the provinces and territories are not strong. And the average domain score is just 23%. Nunavut scores the highest in this domain at 62% because they have a very unique alcohol control system that's fully government owned and operated. PEI, Newfoundland, and Saskatchewan all score the lowest in this domain. So we'll take a look at the indicators that make up our scores for control system. The first set of indicators, which are the blue bars, refer to the structure of the control system. So this assesses whether the regulators and the retailers report to health and safety focused ministries. It also looks at the proportion of government versus private retail stores. Now, so if we look at the proportion of government owned and operated off-premise retail outlets, it ranges across the jurisdictions from 0. So in Alberta and Saskatchewan, which is completely privatized, to less than 30% in Nova Scotia. Obviously, the exception is Nunavut, which I already mentioned. When we look at who the regulators and the retailers report to, there are currently no alcohol distributors or retailers in Canada that actually are overseen by a public health ministry. Alcohol regulators in BC, Manitoba, Ontario, Quebec, and New Brunswick are all overseen by Justice or a public safety ministry. And none of the provinces or territories' alcohol distributors and retailers report to a public health ministry. In fact, 12 of 13 report to a finance-focused ministry or the Crown Corporation. Now, if we look at the orange bars, this refers to alcohol sales beyond traditional channels. So what we're assessing here is allowing alcohol to be sold in other ways. So allowing alcohol to be sold in grocery stores or gas stations or convenience stores, allowing alcohol to be sold online, allowing alcohol to be sold in environments that have other services and goods, so things like at spas or movie theaters, and also includes ferment on-premise outlets. As you can see, there are very few orange bars in this graph. Only the Yukon, Northwest Territories, and Nunavut, and Nova Scotia all score above 0. Everyone else gets 0 in this indicator. And that's because Nova Scotia and the 3 territories all prohibit the sale of alcohol alongside other retail goods. So they do not allow alcohol in places such as grocery stores, convenience stores, and gas stations. The territories score a bit higher than Nova Scotia because they also prohibit online sale of alcohol. In all 10 provinces, alcohol is allowed to be sold online and is also allowed to be sold alongside other goods and services like in hair salons or movie theaters or at sporting events, for example. So the last indicator in the control system domain that we looked at was the degree to which the alcohol policies have a public health and safety focus. So there are many things to consider when we're thinking about a public health and safety focus. So we were looking at For example, whether protecting public health and safety is an explicit objective of the alcohol control system regulator. We looked at whether they earmark funds to support evidence-based harm reduction prevention, research and treatment. We looked at their social media pages to see what proportion of posts are related to health and safety rather than product promotion, as well as whether there's a requirement to gather input from public health when legislative changes are made in relation to alcohol. So if we look at the gray bars, this is a score for this domain. Manitoba, Northwest Territory, and Quebec score the highest in terms of their public health and safety focus of their alcohol control policies. Only Manitoba and Quebec actually earmark funds that are inscribed in legislation to support evidence-based alcohol prevention, research, and treatment programs. And all jurisdictions, aside from Northwest Territories and Nunavut, have mandated online public reporting of alcohol industry lobbying activities. So this is a great way to be really transparent. Manitoba and the 3 territories also have legislated targeted public engagement with a focus on health, but only Nunavut requires public health input and guidance on alcohol-related policy changes through their system of locally elected alcohol education committees. Okay, so the key recommendations for alcohol control system. In order to improve scores in this domain, we're really encouraging jurisdictions to move away from privatization and increase the proportion of government-owned and operated off-premise retail outlets, with the goal of moving towards a full government monopoly. We've pretty much been going in the opposite direction, but this is something that we can change. We also encourage the jurisdictions to appoint a health and safety focused ministry that can oversee alcohol regulation and distribution and retail, and include protection of public health and safety as an explicit mandate. And finally, to prohibit sales beyond traditional channels. So to phase out ferment on-premise outlets, prohibit online sales, as well as prohibit the sale of alcohol alongside other services and goods. Now, if we were to implement all the current best practices that are already being done in Canada that exist in different jurisdictions, our score could improve to 86%. So lots of potential for movement here. So the last domain I'm going to speak to is advertising and marketing controls. We know a ban or comprehensive restrictions on alcohol marketing is not only one of the most effective policies, but also one of the most cost-effective policies in terms of reducing the harms caused from alcohol. When we think about how we might go about restricting advertising and marketing, we're talking about things like regulating the volume of advertisements, so how much advertisement there is, the content of the advertisement, so what's allowed to be advertised, price-based promotions, as well as placement of ads, so where they're allowed to be located. Now, the effectiveness of these types of restrictions, though, are of course contingent on whether or not they apply to all the different types of advertisers and all the different types of mediums, as well as whether there's some sort of independent authority that can actually monitor and enforce the restrictions. So these are the types of things that go into the marketing and advertising control scores. So if we look at across the jurisdictions, we can see that alcohol marketing and advertising control scores vary quite a lot across provinces and territories, with an average score of 33%. Nunavut scores the highest, but not far behind is Quebec and Manitoba. The lowest scores are found in Newfoundland, the Yukon, and Saskatchewan, where there are few and in some cases no regulations that restrict and enforce marketing and advertising. So as I said, when we look at the indicators for this domain, they're essentially broken down into the types of restrictions that you have and whether or not you have policies that can enforce those restrictions. So starting with the blue bars, which refer to the types of advertising restrictions that jurisdictions have in place, PEI, Quebec, and Nunavut score the highest in terms of the comprehensiveness of their marketing and advertising restrictions. There's no full bans across Canada, okay? So there's no full bans on alcohol marketing and advertising in any province or territory. And there are no jurisdictions which have comprehensive restrictions on volume of advertisements that are allowed across media types and advertisers. Nunavut and 7 provinces, though, do have restrictions on alcohol advertising content that go beyond the federal CRTC code regulations. As Tim mentioned, those federal regulations are incredibly outdated and don't apply to digital media. So it's really important that the provinces and territories go beyond those federal regulations so that they are relevant and timely and keep up with the changes in the ways that businesses are advertising alcohol. Manitoba, Ontario, PEI, Quebec, and Nunavut all have restrictions on where ads can be placed. And typically these restrictions are preventing placement of ads near schools or in media that explicitly target youth as an audience. New Brunswick, Nova Scotia, PEI, and the Yukon also all prohibit advertising by non-licensees or third-party advertisers. So companies like Uber Eats or DoorDash cannot advertise alcohol. Only 5 of the 13 jurisdictions, though, implement price-based promotion bans. And so in most of the jurisdictions, they are able to advertise cheap drinks as well as volume-based discounts. So this is something that we're not encouraging jurisdictions to ban. So when it comes to enforcing these restrictions, we know the effectiveness of these regulations is very contingent on how well the policies are enforced. Nunavut, Quebec, and Manitoba score the highest in terms of their enforcement. These are the orange bars. Okay. Newfoundland, Saskatchewan, PEI score the lowest in terms of their enforcement. One of the key recommendations in terms of enforcement is to have mandatory pre-screening across all media types, regardless of advertisers. And we also want that pre-screening to be conducted by a representative that's independent from the alcohol industry so that we can ensure that the advertisements adhere to regulations. Now, currently, Nunavut is the only jurisdiction which mandates pre-screening of alcohol ads across all media types and advertisers. Quebec does mandate some pre-screening, but it's only for manufacturer advertising. So it doesn't apply to all forms of advertising. Manitoba is the only one jurisdiction that has an independent online complaint system that's run completely independent from industry. So this is a system that really ensures that alcohol advertising and marketing violations and complaints are effectively addressed. There are quite a few provinces, including Alberta, Manitoba, Quebec, New Brunswick, Northwest Territories, and Nunavut, who do have a specific authority that's independent of the industry, who's responsible for enforcement. But so they take complaints and they're independent from industry, but they don't have a process for consumers to actually submit complaints. So unlike Manitoba, they don't have an online complaint system that facilitates that. There are 6 provinces in all the territories that publicly list the marketing and advertising violations, and they name the advertiser and the type of violation. But the penalties for these violations in 7 of 13 provinces and territories do not commensurate with the violation, and they don't escalate for repeat offenses. So if we look at the key recommendations for this domain, we encourage jurisdictions to implement restrictions on volume or quantity of advertising, to implement restrictions on content that's beyond the CRTC, to restrict placement of ads, ban price-based promotions, and to really ensure that these restrictions apply to all forms of advertisers and all media types, with a particular focus on digital advertising and digital media platforms. We also want to encourage them to appoint an independent health-focused enforcement authority that can conduct mandatory pre-screening of all alcohol ads, and to host some sort of responsive online complaint system that can respond to complaints in a timely manner. So if we were to implement all these current best practices that are existing across the provinces and territories, we would be able to change our average score, which is currently 33%, to a 72%. So I'm going to turn it over back to Norman.
Thank you very much. I'm just going to highlight a few of the other policy domains that were not discussed in detail in the presentations by Tim and Kara. Here are some brief overall recommendations for the other domains that we didn't cover in detail. For example, impaired driving policies can be strengthened by imposing mandatory comprehensive administrative sanctions. The minimum legal drinking age should be increased to 21, or at least be consistently 19 across the country. Jurisdictions can improve their health and safety messaging by making enhanced alcohol warning labels mandatory on all beverages. We can also have health messaging mandatory across all types of premises. Liquor law enforcement could be strengthened by using risk-based licensing and enforcement criteria. Next slide. Provinces and territories are encouraged to formally endorse the new National Alcohol and Health Guidance. They can strengthen their response to alcohol harms by a standalone government-endorsed alcohol strategies that are developed independently of the alcohol industry. Some leaders in this area are Nunavut, that has had an alcohol strategy since 2016, and Newfoundland and the Northwest Territories that recently released action plans. Provinces and territories can implement a systematic and comprehensive tracking system of alcohol-related indicators as noted in this slide. In conclusion, as noted previously, the 80% is achievable. However, this will not happen through business as usual. It will require that politicians, policymakers, and regulators be innovative and brave. And last but not least, pay close attention to the public health evidence, principles, and values. Turn to Amanda now.
Thanks, Norman and Kara and Tim. Before we get into the Q&A and next steps for CAPE, I want to just go back and quickly mention some things that I forgot because I messed up the slide deck. Importantly, I just wanted to acknowledge a couple of CAPE team members who passed away while we had started CAPE 3. We have Harold Johnson, who was he was many things: storyteller, writer, advocate, elder, a huge champion of alcohol policy. We worked with him quite a bit through various iterations of CAPE, and he sadly passed away early last year. And we also wanted to share that we will have the inaugural Harold Johnson Award for changing the story on alcohol being presented next month on June 6th. At I believe it's in the morning, so please stay tuned for more information on that. And I also wanted to acknowledge the loss of Bob Mann at CAMH. He was a senior scientist with the Institute for Mental Health Policy Research at CAMH, and he was active in the CAPE evaluation team and a valued member of our team since 2010. So we were sad to lose both those folks during CAPE, and I just wanted to acknowledge their contributions to the project before I get started on sharing what were next steps. So thanks to all of our presenters for sharing our results. I'm just going to whip down here. Next steps, we have a lot of knowledge products available as of today, including results summaries for the federal, provincial, and territorial governments. We've got a summary of results broken down by domains. We've got a really great best practice leaders document, which breaks down which jurisdiction Canada is achieving those best practices or the best existing practices. So the great news is, even though some of our scores are not super high, we have the tools to help jurisdictions improve. And a lot of your neighbors are doing great things, and you just need to look to them. So we're hoping that a lot of these products will be put to good use by people on this call and beyond. As mentioned, we are going to be offering tailored jurisdiction specific results and recommendations presentations, as we did with CAPE 2. We have an online request form that will be shared in the chat if you'd like to request a tailored seminar, kind of in a similar format to this, specifically looking at your jurisdiction. We'd be more than happy to do that. We've been engaging on outgoing outreach with people with lived and living experience organizations across Canada. So we're going to be continuing to do that post-CAPE launch. We are also, our community of practice is going to continue to be active. It's been such a great resources for both us and hopefully for the folks who have joined, in terms of just sharing knowledge and learning on alcohol policy. If you aren't already a member, please, this is my plug to please sign up to receive regular updates. And all of this information, plus a lot more valuable information on alcohol policy, is on our website, which is on the screen here and has been shared a couple of times.